Pancreatic cancer is one of the deadliest diseases, not because it's unstoppable, but because most people never see it coming until it's too late. The signs start small. A change in urine color, a strange pain in your back, or a sense of fullness that won't go away. Most of us dismiss them, but your body could be whispering a warning you can't afford to miss. Doctors now know that recognizing just 3 early signs can boost 5-year survival rates nearly 4-fold. And in this video, we'll uncover all 8 before they're ignored again. The real question isn't, could this happen to me? It's, would I recognize the signs if it already had? Stick with me, because symptom number 4 is one that you can literally feel from the outside, if you know where to look. Number 1, dark yellow or brown urine. Dark yellow or brown urine might not seem like a big deal at first, but it can be a major red flag from your pancreas. What's really happening is your bile duct could be blocked, causing a buildup of bilirubin in your body. And when that happens, your urine turns darker sometimes, even before your skin or eyes show any yellowing. That's right, the color change in your urine might be the very first visible clue that something serious is going on. Most people think it's just dehydration or something they ate, but this deep color shift can be your body quietly alerting you to trouble.
What are the symptoms of pancreatic cancer? Number 1, obstructive jaundice, with which you would have yellowish discoloration of the urine, the sclera, itching all over the body, and pale color stools.
Now here's the part most people miss. This isn't just any color change. It's not the kind you fix by drinking more water. This kind of dark urine sticks around and doesn't improve, even with hydration. So if your urine starts looking tea-colored or cola-like, don't brush it off. It's your pancreas possibly signaling that bile isn't draining the way it should. And that's a warning you need to take seriously.
Often the most telling symptom is a patient develops jaundice, and that's due to blockage of the main bile duct from the cancer. And so patients will notice that their eyes turn yellow, and that will prompt them to seek medical attention.
But while this symptom shows up in the bathroom, the next one creeps in through your back. It hides in plain sight, feels like a pulled muscle or regular soreness, and gets dismissed way too often. Let's talk about that next. Number 2, upper abdominal or back pain. Upper abdominal or back pain that feels deep, dull, and stubborn might not just be a random muscle ache. This kind of pain often shows up like a tight band wrapping across your upper belly and into your lower back. It's not sharp like a cramp, but more like a deep ache that lingers. And it usually gets worse after you eat or when you lie down.
Here's 5 early signs of pancreatic cancer. Pancreatic cancer is so deadly because it's caught so late. So here are the 5 subtle signs you may see that could save your life. Abdominal pain or mid-back pain. This does not have to be severe. It can be a dull ache. Also, someone with new onset diabetes not associated with weight gain.
That's because the pancreas is tucked right behind your stomach and near your spine. So when it's inflamed or a tumor is forming, it presses on nearby nerves. Most people don't link this kind of discomfort to something serious, thinking it's just gas, posture, or stress. But when this pain doesn't ease up or keeps coming back in the same area, it's time to pay closer attention. What makes this tricky is how easily it blends into your daily life. You might pop a painkiller or stretch it out, hoping it goes away. But if it becomes a pattern, especially paired with other subtle signs, it's worth asking your doctor about. Pain that lingers without a clear reason, especially around meals or when resting, could be more than just a sore back. Now, while this symptom may be silent to others, your own body might be trying to tell you something with another sneaky clue, one that hides in your stomach. Let's talk about that next. Number 3. Gas, bloating, and early satiety. Gas, bloating, and feeling full too soon might sound like harmless digestive issues, but when they start happening more often than usual, they could point to something more serious. If you find yourself getting uncomfortably bloated after just a small meal, or feeling stuffed after only a few bites, your pancreas could be involved.
And one of the rare symptoms that presents is on advanced disease, you can have abdominal bloating because of fluid collection, and also symptoms due to spread to other parts.
When a tumor grows near the pancreas, it can press against the stomach or intestines, making digestion slower and space inside your stomach feel tighter. That pressure makes your body respond, as if you've eaten way more than you actually have. What makes this symptom even more sneaky is that it often gets blamed on overeating or poor food choices.
Now, if your pancreas is not producing enough enzymes and it's having trouble to make sure that your system is releasing these enzymes into your digestive system, then you will have enormous amounts of production of gas. Your food, instead of being digested by these enzymes or probiotics, you will see them ferment. And this fermentation process will lead to a problem with production of gas.
But if you're eating light yet still feel like you've had a feast, and the bloating gets worse after fatty foods, it's not something to ignore. This kind of discomfort sticks around, especially in the upper abdomen, and no amount of antacids or tea seems to make it go away for long. It's your body telling you that something's off with how it's processing food and moving things through your system. And when that sense of fullness keeps coming back without explanation, it's time to dig deeper. But that's not all your body might be trying to show you. The next clue could show up in a surprising place: your skin. Let's take a closer look. Number 4. Swollen gallbladder or liver. Swollen gallbladder or liver is one of those signs that can actually be felt, but only if you know where to look. When the bile duct is blocked, usually by a tumor pressing on it, bile starts to build up in the system. That buildup doesn't just stay quiet, it causes organs like the gallbladder or even the liver to swell. You might notice a strange, firm feeling under your right ribs, or a kind of fullness or pressure in that area that doesn't go away. It's not always painful, but it's there. And it's different from usual digestion discomfort.
Pancreas is not easy to get at. It sits in the back of the abdomen. There's not an easy way to put a scope in and look at it. And so there's not easy access of a biosample, if you will, a sample of cells or fluid to test for cancer.
Some people try to press gently under their rib cage and end up finding a hard, swollen area without meaning to. That firmness could be the gallbladder pushing outward from all that bile stuck inside. It's not something that comes and goes with meals. It tends to stay and feel oddly solid. When an organ starts swelling like that, it's your body's way of waving a red flag and asking you to take action.
Many of the early symptoms of pancreatic cancer are fairly nondescript. Some mild pain, a little bit of unintentional weight loss, and so patients don't really think there's something serious going on until the symptoms really progress.
This kind of swelling doesn't just affect your digestion, it's a deeper clue that something's disrupting the normal flow of bile and causing pressure in your abdomen. And while this one might be felt on the outside, the next clue is much more hidden, but even more dangerous. Let's talk about that next. Number 5. Blood clots, deep vein thrombosis or pulmonary embolism. Blood clots might not be the first thing you associate with pancreatic cancer, but they're one of the most dangerous signs your body can give. When cancer is present, especially pancreatic cancer, it releases certain proteins that trigger inflammation and increase the risk of clotting. This means your blood can start forming clots in places it shouldn't, like the deep veins in your legs or even your lungs. One day you feel fine, and the next, your leg is swollen, tender, or suddenly aching without any injury. That's not just a sore muscle. It could be a deep vein thrombosis, and it needs medical attention right away. Even more serious is when a clot travels to the lungs and causes a pulmonary embolism. If you suddenly feel short of breath, dizzy, or have chest pain that won't go away, don't brush it off. These aren't just random symptoms, they're emergency level warnings. Pancreatic cancer creates a kind of hidden storm in the body, and these clots can form quietly before anyone even realizes something is wrong. It's not about being paranoid. It's about being aware of unusual changes that don't match your usual health pattern, especially when no other reason explains it. But now, let's talk about a symptom that mimics the flu, yet might be something far more serious. Number 6. Fever and shivering. Fever and shivering without a clear infection can be one of the most misleading signs of early pancreatic cancer. It feels like you might be coming down with a cold, or maybe just overworked, but your body could be reacting to hidden inflammation around the pancreas. This kind of immune response isn't always dramatic. It often shows up as low-grade fevers that come and go, paired with strange night chills that leave you waking up drenched in sweat or wrapped in a blanket no matter the weather. It might happen a few times and then vanish, making it easy to ignore or blame on stress. But this isn't your average flu. When your immune system senses trouble deep in the abdomen, like a growing tumor, it can trigger small, repeated spikes in body temperature. It's your body's way of trying to fight back against something it doesn't quite understand yet. The key is to notice when these fevers aren't acting like normal ones, They're not part of a seasonal virus, they don't respond the way typical fevers do, and they often don't come with other infection signs like a sore throat or cough. When your body keeps sounding the alarm and you can't explain why, don't ignore it. Because the next clue could be even harder to dismiss when your energy disappears completely. Number 7. Fatigue or weakness. Fatigue that lingers, no matter how much you rest, isn't just a sign of stress or a poor diet. In the case of pancreatic cancer, it happens because the cancer cells are robbing your body's nutrients, leaving you drained and sluggish. This fatigue isn't the kind you can fix with a nap or a good night's sleep. It feels like your body is weighed down, your mind is foggy, and even simple tasks become exhausting.
Another common symptom is fatigue, just feeling tired all the time. If someone does have pain from pancreatic cancer, the pain is initially intermittent in nature and later becomes a steady pain and is localized in the epigastric region, so right up in here, and it typically radiates to the back.
You may find yourself struggling to concentrate, losing interest in things you usually enjoy, or needing to rest more than usual just to get through the day. Fatigue on its own is concerning, but when it combines with other symptoms, like upper abdominal pain, unexplained fever, or dark urine, it becomes an even louder warning. It's the combination of these symptoms that truly matters. Your body is trying to tell you something serious is happening inside. And if your digestion also starts acting up, with greasy, pale stools, your pancreas might be giving you its final warning, one you shouldn't ignore. Number 8. Digestive problems, greasy stools, nausea. Digestive problems that show up out of nowhere, especially when your diet hasn't changed, can be one of the clearest signals that your pancreas isn't doing its job. When the pancreas stops making enough enzymes, your body can't break down fat the way it should. That fat ends up slipping right through your digestive system, which leads to greasy, pale stools that often float and leave oily residue behind.
The lesser common symptoms are weight loss, loss of appetite, along with nausea and vomiting. Abdominal pain is seen in advanced cases where there will be pain which is radiating to the back.
It's not just unpleasant, it's a strong clue. You may also notice frequent bloating, stomach cramps, or the constant feeling that something's off after eating. Chronic nausea is another major sign, especially if it shows up often, without food poisoning or stomach bugs to blame. You could feel full too quickly, lose your appetite, or even feel like throwing up after meals. When nausea, strange stools, and a weak appetite all start happening together, your digestive system is waving a red flag. Now here's the final clue that ties everything together. Your body gives you subtle clues long before things get critical. Catching just a few of these symptoms early could be the difference between life and death. Don't ignore the warning signs. Which symptom surprised you the most today? Drop a comment below and let's raise awareness together. You might just save a life.